Hello viewers, this is Dr. Hiya Agarwal, fertility consultant at Neelkanth IVF Jodhpur. Today we will be discussing about how the thyroid disorders affect the fertility as well as the woman reproductive health in general. Thyroid dysfunction has shown to have an effect on the ovulation in the woman and thus can result into potential infertility. Thyroid dysfunction has also been associated with the decreased implantation rate as well as very much have a role in the early organogenesis, and if there is a thyroid dysfunction, the women have tend to have a repeated pregnancy loss. So attaining a thyroid balance for a normal reproduction is very much required in women. Any woman who is planning a pregnancy should undergo a thyroid checkup to see whether her thyroid levels are within normal limits so she can avoid a potential fertility issue as well. Even if she conceives, there might be a decreased risk of miscarriage for her. So what are different disorders which can be seen with the thyroid hormone? One is hyperthyroidism. In this condition, there is increased production of thyroid hormone in the body. It may be due to autoimmune diseases. It may be due to improper intake of thyroid hormone as a replacement. Maybe due to a growth in the thyroid gland called as goiter, which is being producing more thyroid hormone, which is not required in the body, resulting into hyperthyroidism. It presents as palpitations, increased sweating, increased appetite, loss of weight, restlessness, increased anxiety, patient irregular menstrual cycles, losing weight despite increased appetite. These are the common symptoms which can be associated with hyperthyroidism. There are very good anti-thyroid medications available which can decrease the thyroid production in the body and hence improve the symptoms associated with it. Certain medications which can decrease the thyroid levels are safe in the pregnancy. So if there's any issue with the thyroid hormone and you are having an increased thyroid levels, you should consult with your fertility expert and endocrinology expert for the better advice. Another disorder which is seen with the thyroid hormone is the hypothyroidism, which is the opposite of it. That is when there is a decreased production of the thyroid hormone, which less than the normal, then it is called as hypothyroidism. In this condition, the women usually experience increased weight, letharginess, puffy cheeks, puffy eyes, and irregular menses along with menorrhagia, that is increased bleeding during the periods. There is improper ovulation resulting to the potential infertility in women. It can easily be corrected by giving a thyroid replacement, synthetic thyroid hormone, which is usually called as thyroxine. It has to be taken in the proper strength, which is as prescribed by the doctor. It has to be taken in the morning, 1 tablet, or as prescribed by your doctor, empty stomach, and first thing in the morning. And it should be followed by a hot beverage only after 30 to 45 minutes. You should titrate the dose of your thyroxine tablets according to the repeated TSH test in the first of your starting the thyroxine tablets. Usually we repeat the blood test required for testing the thyroid hormone levels around 6 to 8 weeks after starting the dose. Thyroid hormones should be very normal when a woman is trying to have a pregnancy, and it can easily be corrected. It is a very correctable cause of infertility. Even after correcting the thyroid and when the woman becomes euthyroid, couple can still face fertility issues. If they are still facing the fertility issues, then this couple can consult the fertility expert for further treatment and advanced treatment which can help them achieving parenthood. If you have any query regarding the thyroid hormone disorders and what treatment should be prescribed, or you have any fertility issue, you can consult the number given below or call the number given below. Thank you.